Hi everyone. When can I visit my loved one in a long-term care home is the million-dollar question. It's been months now since most folks have been able to visit their loved ones in the nursing homes. Well, there is good news. CMS, the Center for Medicare and Medicaid Services, has revised the guidance for visits in long-term care homes. I invite you to do a web search for the memo QSO-20-39-NH. This will give you all the details. Thanks for joining us. Let's hit the high points of the memo by talking about indoor, outdoor, and compassionate care visits. A facility now must facilitate in-person visitation and only restrict when there is a reasonable cause. This is new because previously it had basically been up to the facilities to determine if they were going to allow visits. So for indoor visits, if the county COVID positivity rate is above 10%, indoor visits can only be for compassionate care. This is very important because prior to this change, many homes didn't allow families to visit their loved one at their end of life. And if they did, it was only for a few minutes. And they didn't even allow hospice sometimes. Now, hospice is allowed as well as compassionate care. More good news is compassionate care no longer strictly pertains to end-of-life care. It can be to visit neighbors who are in distress, who are grieving, who are suffering from a lot of depression, who need help eating or drinking help was previously provided by the visitor. So not only at the end of life, but also for what they're calling compassionate care, which encompasses a lot of other things besides just the end of life. So visits should be outdoors when practicable. The facility should facilitate these outdoor visits routinely, just like they should facilitate indoor visits when it's possible. Outdoor visits, of course, become less feasible when the weather changes, and we're in fall right now, and the weather's getting colder, and it may not be appropriate for the residents or the neighbors to be outside for visits. So all visits, whether inside or outside, should be person-centered and focus on the needs and preferences of the neighbor. They should be in private, and it's very important to follow strict infection control policies such as wearing masks properly, keeping 6 feet distance, and practicing hand hygiene. As a visitor, you may also be screened, and you could also possibly be required to test negative for COVID. But heck, it's a small price to pay for an in-person visit with your friend or loved one that you have not seen in months. If you find you are wrongly not allowed to visit a friend, reach out to the local long-term care ombudsman. Our services are free and confidential, and we would love to help you connect with a resident. Until next time, join us in upholding the dignity and quality of life of those neighbors living in long-term care neighborhoods. Thank you.